There is nothing more important to a parent than the health and well-being of their child. And whether your child is a newborn, an infant, a toddler, an adolescent, even a young adult, there is nothing that takes higher priority. That's why we have a children's hospital here.
The Goryeb Children's Hospital was founded in 2002 through the generosity of Marge and Joseph Goryeb and their family, as well as other lead donors like Jill and Dave Ferris, the Women's Association of Morristown Medical Center, Lois and Neil Gagnon, and the Oresti family. Over the last 10 years, the hospital has expanded as a result of their continued support and donors such as the Our Baby Foundation, the Valerie Fund, Becton Dickinson, Mid-Atlantic Neonatology Associates, and Doris and Steve Salzberg. This support, along with the expertise, care, and selfless efforts of the dedicated doctors, practitioners, and staff, has made Goryeb Children's Hospital one of the premier facilities in the state of New Jersey.
The Goryeb Children's Hospital cares for children and their families 0 to 21 years of age, often children over 21 years of age as well. The subspecialty divisions, there's many. It range from anything from our cardiology division to gastroenterology to neurology, and each one of those divisions also has niche services within those divisions. So an example is like in our neurology division, there's a headache center, or there's an epilepsy department within that division. So each service has extended services within it.
We are so lucky in this community to have excellent pediatricians. But what happens when a child needs emergency care because they're injured or they're acutely ill? What happens when a pediatrician needs help from a specialist?
What often happens for many of the children who come to the NICU here at Morristown come from other hospitals. So the Goryeb is a perinatal center, so children and mothers are sent to Morristown to deliver and to the children's hospital. And part of it is for the type of care that my group would be able to give for the care of premature babies. But many of the babies come here because they don't have pediatric subspecialists at the other hospitals. And they're not a children's hospital. I'm so terribly proud that we actually are able to say that we have this outstanding center for children in New Jersey that really has attracted a very fine group of pediatric subspecialists.
It starts with the doctor, but then you need the right nurses and respiratory therapists and child life professionals and everyone else on that healthcare team.
Working at a hospital, a children's hospital, it opens up so many possibilities for me as a physician, but also for the children, because I can call on almost anyone and then come up with a plan that is inclusive of many types of doctors.
We have specialists in every specialty within pediatrics to support those pediatricians and families in the community when a higher level of care is needed.
Patient and family-centered care is something that's very near and dear to our hearts. We have a Parents Advisory Council which helps to lead the way, and it's a journey. We're somewhere in the middle of that journey. We don't expect that journey to ever end because there's always going to be more that we can do with our families. What our advisors do, they sit on many different committees. They sit on a main advisory council where there's a detailed agenda and they help guide us in our decision making.
At Goryeb Children's Hospital, we aim to go beyond just having great depth and breadth of our services. We want to go past having just the best doctors, the most excellent teams of care. We are innovating. We are building the Center for Advanced Medicine in Pediatrics, affectionately known as CAMP. And what we're going to do with that is we're going to integrate multiple different doctors from different specialties to care for very complex disorders in pediatrics. Things such as inflammatory bowel disease, Crohn's disease, ulcerative colitis, juvenile arthritis, lupus, infectious diseases that have an inflammatory component. We're also in this camp going to be seeing children that have recovered from childhood cancer that we've treated and others have treated, to look for ways to make sure that they're still doing well and that the results of their cancer treatment hasn't created other problems. We're building a craniofacial center, which we already have in operation, but it's going to be a beautiful new facility that will facilitate the doctors meeting with parents together and having teams of doctors work together. And there'll be more. This is something that is not offered anywhere in this area. We're very proud that we're reaching this new milestone.
Our pediatric intensive care unit started as an 8-bedded unit, and surprisingly, we had to grow to a 9th bed fairly shortly. And we're at a point right now where we need to grow by 3 more beds. And the reason that we need that growth is because we don't want to say no ever to a family who needs our services. The Goryeb Children's Hospital doesn't just care for its immediate community. We're very far-reaching. We have a helicopter service. We do ground transportation. We see families from not all over the state, but beyond that, Pennsylvania into New York. Families who are here visiting may have a trauma and need to have their child admitted, and you just never want to say no. So we really need for our philanthropy group and our donors to help us support that goal of growing those additional beds, as well as growing our pediatric unit, because although pediatrics very much is an outpatient service, when you're a children's hospital and you regionalize care and you deliver the best care that's there, people are going to come. So we built it through the Goryeb family and their support, but it needs to get bigger, and we need that support to make it happen. We're looking to add on more beds because our epilepsy division has grown, and all our other subspecialties have grown as well.
When I was a week old, I got really sick with a dangerous respiratory virus. My parents were scared and took me to Goryeb Children's Hospital, where the doctors and nurses made me better. If you're a kid, teen, or young adult, and you get hurt or sick like me, they'll take good care of you. Next week, I turn 10. I'm healthy, quick, and love playing hockey. Thanks, Goryeb, for helping me grow and stay strong.